Hi, I'm Jordan Potts, Family Nurse Practitioner at CHRISTUS Trinity Clinic.
Hi, I'm Bridget Coker, Family Medicine Physician at CHRISTUS Trinity Clinic.
I always knew that I wanted to be in the healthcare field. I decided to go the nursing route because it was important to me to be able to perform hands-on bedside care for patients when they needed it the most. The decision to become a nurse practitioner was very easy to make. I wanted to be able to continue to have an instrumental part in my patients' health care, and I wanted to be able to help my patients in my own community. The experience that I learned as a nurse at the bedside has been more than valuable in my experience as a nurse practitioner. As nurse practitioners, we're an important part of the medical team. We're able to improve access to patient care. We provide high quality patient care. We're able to, collaborate with the physicians, yet at the same time have our own independent panel of patients. We emphasize health management and primary prevention, which is your screenings and basic wellness.
Yes, not only do nurse practitioners act as physicians extenders, which a lot of patients believe that they just see our patients when they can't get in to see us, but they can also see their own patients. They can see patients for their general physicals, for their immunizations, for their labs, if you need a referral for a specialist or any lab tests, whether basic lab tests or they're coming in for abdominal pain or cough. Jordan, other nurse practitioners are very good at working those problems up just as a physician would.
Nurse practitioners require at a minimum a master's degree, with many going on to get their doctorate as well. The schooling is based on evidence-based practice and research along with holistic care. Once nurse practitioners graduate, they're required to go sit for a board, similar to what a physician would do, to become board certified and get their license. We perform numerous hours of hands-on experience during our schooling and clinical experience.
Jordan and I work well together, as most nurse practitioners and their providers work together with our full panel of patients. They can see only Jordan, only myself, or both of us together, but we are utilizing each other behind the scenes all the time. When we have patients that come in and need to be seen for follow-up and our schedule's just not available to see them at the right time, then they can go see Jordan. And when Jordan's patients need to be seen, then they can see me as well. When we are out on vacation, then we follow up on each other's patients' labs and test results. If there are any phone call questions or portal questions, then we can follow up on those while the other person is out. We also may utilize each other while we're in the room. If we see something interesting, a rash, then we may go grab the other person to discuss it so we can both get that experience. Or she may have seen something in her prior experience that could help me along with the diagnosis and treatment plan, and the same goes for me to her. When we do a procedure, sometimes we need an assistant, and I'll go and grab Jordan, or she'll come and grab me, and we can help each other out. And then also, it's nice to have a fresh pair of eyes, a fresh perspective. I may see a patient and only focus on one thing every time they come. They happen to follow with Jordan, and she may catch something different than I was seeing because I was so tunnel visioned. And it's nice for patients to have two sets of eyes both looking at them to make sure we aren't missing anything and taking the best overall assessment of the patient to come up with the best treatment plan in that particular case.
Nurse practitioners are able to perform many of the same services that physicians do. We do physicals, well visits, along with sick visits, and treat acute problems. We see many patients for chronic diseases such as high blood pressure, diabetes, COPD, and many other conditions. We're also able to perform some in-office procedures, and we get referrals to specialists as needed.
There's a big misconception between patients about nurse practitioners that they are only a physician extender, meaning if my patients get sick, get a cold or a stomach ache, and they need to see someone and they can't see me, they'll go see nurse practitioner like Jordan, no problem. What they don't realize is that they can see them for the entirety of their care. Jordan and most nurse practitioners alike, if they have any questions, they will come next door. They will ask me to come assess the patient or just run through the problems. But most of the time, she's fully capable of handling everything from your physicals, immunizations, referrals, labs, just like I would do. I think we've kind of talked about that earlier today. But I wish patients knew that they could have full faith in their nurse practitioners, that they're very well trained to give you the best care possible. I want everyone to know that nurse practitioners aren't simply a physician extender. Everyone expects that they'll see them for their acute needs, a cough, cold, sore throat, earache, stomach pain. But what they don't realize is nurse practitioners like Jordan can take care of their complete medical needs. She can diagnose their problems, she can work up their problems with lab tests, imaging orders, she can do referrals, she can do her own prescriptions, she can pretty much treat anything she needs. But if there are questions, she wouldn't hesitate to come ask.